Please be advised that the information in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult a practicing medical professional. Thank you for your attention and enjoy today's episode. What is up, cooties and germs of the internet? My name is Tony, and you're currently tuned in to Hemp Nerd, the podcast that helps you know your cannabis and cannabinoids so you can get reliable therapeutic results. Now, in today's particular episode, we're going to be diving into the question, does CBD oil work for bursitis? And in order for us to do that accurately and successfully, or as successfully as possible, we first need to understand what bursitis is. So, what is bursitis? So, bursitis is described as an inflammation of your synovial bursa, or bursae for plural. Your synovial bursa is a lubricating sac located around your joints between your tendons, muscles, and bones. A bursa sac is made up of a synovial membrane or synovium that contains and produces synovial fluid. The added lubrication bursae provide help reduce friction during joint movement. Now, what causes bursitis? Now, there are a variety of scenarios that can cause bursitis, and similar to tendonitis, bursitis can be caused by injury due to repetitive overuse or misuse of your joints. So not only can you get bursitis, you can get tendonitis as well. So be careful with your joints there. Medical conditions such as arthritis, gout, diabetes, and kidney conditions caused by alcoholism contribute to the development of bursitis, specifically arthritis. For me, that's a big highlight because most of the research that I dive in today has to do with arthritis and how CBD oil and cannabis works in the treatment of arthritis, because obviously that is one of the main causes of bursitis. Additionally, bacterial infection to your bursae close to your skin causes a variation of bursitis medically known as septic bursitis. Now, bursitis can also be caused by calcium deposition along a tendon or joint. Now, the areas where you're most likely to get bursitis are your elbows, shoulders, knees, heels, hips, and your buttocks, believe it or not. Now, what are the symptoms of bursitis? The common symptoms that make up bursitis include localized pain, inflammation, stiffness, swelling, and tenderness, warmth around the affected area, redness of the skin around the affected area, pain that worsens with movement, again similar to tendonitis, and a potential fever as well. So it seems like the pain that comes from bursitis is strongly linked with inflammation, because if your bursa or your synovial bursa did not get inflamed, then chances are that you wouldn't feel the pain. So that's my take on it so far. Of course, I'm not a medical professional by practice, so always seek the guidance of a qualified and practicing medical professional. Now, what is the current treatment for bursitis? Now, the current treatment model for bursitis, and I wish I found this when I was going through my tendonitis and tennis elbow and golfer's elbow blog posts and podcasts, but it's a treatment model that's known as, or abbreviated as, PRICEM, or PRICEM, as I like to say. So the P stands for protection, or protection padding, particularly for bursae close to the skin. The R stands for resting, so resting the affected area to aid in alleviating symptoms, again similar to tendonitis. The I stands for icing, so icing the affected area to reduce swelling and inflammation. The C stands for compression, and the E stands for elevation, wherever feasible, to compress and obviously elevate the affected area. And I believe that's going to help reduce inflammation. And lastly, the M stands for medication, to reduce pain and inflammation. So again, it seems like inflammation, obviously we have obviously defined it as the inflammation of your synovial bursa, but it looks like once you eliminate the inflammation side of things, then all the other symptoms may or will fall away. Again, consult with a practicing medical professional. Now, if your bursitis is not infectious, your doctor may provide you with steroid injections to help reduce inflammation. However, if your bursitis is infectious, your doctor will drain your bursa with a syringe and prescribe you with antibiotics. Now, it's obvious to see that CBD falls within the M section of the PRICEM or PRICEM treatment model. where again the M stands for medication when treating for bursitis in this case. Now, current bursitis medication aims to provide pain relief and reduce inflammation around your affected joints. However, the challenge with current medication options such as non-steroidal anti-inflammatory drugs or NSAIDs and low-dose steroids is that they're filled or fraught with side effects, especially when they're used for a long time. Now, the hope that cannabis-based medicines provide is that they can achieve the same results, if not better, without the negative side effects. As it currently stands at the moment, cannabis-based medicines such as CBD oil, for example, have a positive side effect profile. So the question of the moment, the question of the day is, does CBD oil work for bursitis or cannabis-based medicines? That's what I'm more curious about diving into this topic or into this question. So based on my research so far, I can confidently say that cannabis-based medicines such as CBD oil will work for bursitis treatment. The anti-inflammatory properties of CBD and other non-psychoactive cannabinoids have been studied in human and rodent models of arthritis. And again, that is a key statement there. I'll read it one more time. The anti-inflammatory properties of CBD, and other non-psychoactive cannabinoids, not THC, okay? Other cannabinoids other than THC that are non-psychoactive, of course, that don't give you a high, have been studied in human and rodent models of arthritis. And arthritis is a very important condition to I guess, dig into, because arthritis, as we know now, is one of the main causes of bursitis, okay? The pain relief effects of CBD combined with THC, okay, have been studied in human clinical trials on patients with fibromyalgia, arthritis, and advanced cancer pain. So if you're already familiar with my content up to this stage in my journey, then you know that I've brought up the fibromyalgia study, which I'm going to bring up again because it's relevant for this question, as well as the advanced cancer pain study. So those two are pretty relevant to what we're talking about today, hence why I'm bringing them up once more. So firstly, let's dive into, and another thing to point out as well is that, back to that statement, the CBD, the pain relief effects of CBD combined with THC. You see, and this is something that's going to come to light. It's going to make more sense once I actually go into one of the studies, which I'm going to start now. But what I'm trying to highlight there is that pain relief effects, if you're not familiar with my content so far, what they found, which I'm gonna flesh out in the next few minutes, is that the best pain relief effects seem to come when CBD is combined with THC. I mean, you can get pain relief effects from THC alone. However, the studies so far that I've managed to dig up, which is not hard to dig up, but I've managed to dig up and look at, all point to the best pain relief effects coming from CBD and THC in a 1-to-1 ratio. Anyway, let's dive into it. Let me show you. If you're not familiar with my content, let me show you. So first study is a 2005 rheumatoid arthritis patient study. A cannabis-based medicine, CBM, that I like to call them, called Sativex, was used to determine the effectiveness of cannabis for joint pain relief. Okay, so we're looking at rheumatoid arthritis. The CBM was a 1-to-1 ratio of CBD to THC and was tested against a placebo. The study found that the CBM produced significant pain relief effects for the patients. Now, the study also found that the CBM suppressed the inflammatory effects of rheumatoid arthritis. Now, if you don't know, rheumatoid arthritis is an autoimmune disease that causes pain and inflammation, swelling, tenderness, and stiffness that leads to immobility and deformity of your joints. So that's really important to highlight there, that this not only did the patients gain pain relief effects from using the CBM called Sativex, which had a 1-to-1 ratio of CBD to THC, but also the inflammatory effects of rheumatoid arthritis were suppressed. Okay, as you know, if you look into arthritis, I don't expect you to know this because I didn't know this until I actually dove into the research. How sinister of a disease rheumatoid arthritis is. It's basically your immune system attacking healthy cells in your joints. You're causing inflammation and pain and all the other symptoms that I mentioned there, to the point where your joints are immobile. You can't use them properly. They're too stiff to bend or to use, and your fingers or your joints get deformed, and it's really bad. Like when you look into it, you see how sinister it is. It's very, very bad. But the good news is, and this is going back to 2005. So I'm surprised, like, they found this out in 2005. Why isn't this like mainstream medicine? where a 1-to-1 ratio of THC and CBD, can actually suppress the inflammatory effects of rheumatoid arthritis and produce significant pain relief effects. Anyway, hopefully our work here with HempNerd can move the needle in the right direction for people. Next is a 2019 fibromyalgia patient study where a small set of CBMs, and again, when I say CBMs, I mean cannabis-based medicines, were used to determine the effectiveness of cannabis for pain relief. So the CBMs used were a CBD dominant solution, that's one, a THC dominant solution, that's another one, a combined 1-to-1 ratio of CBD and THC, or should I say combined solution, we'll just call it that, and a placebo. Now, the study found that the combined solution of CBD and THC was the most effective for pain relief in the patients with fibromyalgia. The study also found that the CBD dominant solution lacked any pain relief effects for the patients. So it didn't help, because with fibromyalgia, it's pure, you're mainly dealing with pain. There's no inflammation that you're dealing with that one. Because when I looked into it, I was wondering, is this an inflammatory disease, or is there inflammation that is one of the symptoms that shows up? And no, it's not. It's purely pain. But it's still relevant to show that, when you're dealing with, because bursitis is inflammation led, that's the leading symptom or the leading issue, and then pain and everything else comes about. And just in case you may have it twisted that CBD is the cure-all, you can clearly see in this study, they've looked at a pain-focused condition, and they found that the CBD dominant solution, of course, they looked at CBD, THC combined and a placebo, but the CBD dominant solution lacked any pain relief effects for the patients. So it was clear as day. They also found that the THC dominant solution produced notable pain relief effects. Not significant like the combined solution, but notable. It was noteworthy, so to speak, but none higher than the combined solution. So obviously the combined solution was number one, the THC dominant solution was number two, and then taking the last spot was the placebo and the CBD dominant solution, where they were lacking pain relief effects. If there was any if anyone was dealing with inflammation, or fibromyalgia had some inflammation as one of the symptoms, then I personally believe that the CBD dominant solution would have kicked butt in that situation. Now, if you don't know, fibromyalgia is a chronic pain syndrome that causes muscle pain, joint stiffness, tenderness, fatigue, anxiety, and a host of other symptoms, none of which is inflammation, based on my research so far. Now, in a 2010 cancer patient study, a small set of CBMs, again, was used to determine the effectiveness of cannabis on patients with advanced cancer pain. The patients were on strong opioids before the study and did not experience adequate pain relief results. The CBM studied were a THC dominant solution, a combined solution of CBD and THC, and a placebo. Again, the study found that the combined solution of CBD and THC produced better pain relief effects than the THC dominant solution, than the placebo, and better than the opioids that the patients were previously on. So again, the combined solution of THC and CBD in a 1-to-1 ratio is kicking not only THCs but alone, and not only whatever the placebo was, whether it was fake or real, but also the strong opioids that these cancer patients were on. Now, why is this a relevant study to bring about? Because, look, cancer, specifically blood cancer, the different types of blood cancer are known to cause pain and inflammation in your joints, muscles, tendons, bones, and soft tissue. So it is worthy of highlighting and bringing up in this conversation as to whether it would help for bursitis, because again, bursitis is led by inflammation and then pain and everything else. So with this study, again, yes, the cancer patients were in pain. So the THC to CBD dominance, the 1-to-1, the combined solution was the one that produced the most significant pain relief results. However, I'm sure there was inflammation that was being experienced, and I'm sure they got some anti-inflammatory results as well, but that's not what this study was looking at. However, blood cancer can cause that. Now, in a 2000 rodent model study, researchers set out to determine the therapeutic effectiveness of CBD in mice with collagen-induced arthritis, CIA, I'll call it. And not, obviously, when I say that, I'm not talking about the organization in the US. I'm talking again about collagen-induced arthritis, just to make it super clear. The study found that the daily administration of CBD in mice with CIA inhibited the progression of arthritis. again, arthritis. Okay, I'll get into that later. The study showed that the synovial cells from mice treated with CBD released significantly less tumor necrosis factor alpha, or TNF alpha, or just TNF, than the synovial fluid from control mice. Now, TNF or TNF alpha is an inflammatory cytokine produced during acute inflammation. The researchers observed that the anti-arthritic potency of CBD is a result of immunosuppression and anti-inflammatory action by way of reducing the TNF in the synovium. So, what they're trying to say there, if I understand this correctly, see the result, the CBD's anti-arthritic potency. So CBD in fighting against arthritis is a result of suppressing your immune system from attacking any healthy cells, because that's pretty much what arthritis is, especially rheumatoid arthritis, which is autoimmune. It just does it by itself. And the anti-inflammatory effect of reducing the TNF. So you get you have an anti-inflammatory effect because TNF is being reduced, okay, in your synovium, and that's, well, not in our synovium, but in the synovium of the mice. Okay, so if this is what's happening in mice, there is a strong potentiality, at least some hope that it would happen in human beings as well. So reducing TNF, and also immunosuppression, reducing the activity of your immune system when it comes to dealing with arthritis, actually suppresses or inhibits the condition from spreading any further. So the study concluded that CBD has a potent anti-arthritic effect. Alleviating inflammation could lead to a compounded pain relief effect. Okay. Now, this study is worth highlighting because arthritis is one of the main causes of bursitis. I've said this multiple times in this particular episode, and as we've learned so far, bursitis is the inflammation of your synovial bursae found in your joints, or your synovial bursa found in your joints. Though it's a rodent study, the findings provide a bit of hope that humans may stand to gain from using CBMs to treat conditions like bursitis, and most notably arthritis, because that's what we're looking at. But the question we're answering is for bursitis. To further the case for humans, though, there's one more study I believe I need to bring to the surface. So in a 2008 patient study, researchers set out to determine whether key elements of the endocannabinoid signaling system that produced anti-inflammatory and pain relief effects are expressed in the synovia of patients with osteoarthritis and rheumatoid arthritis. Okay, so they're going to see if the signaling system that produces anti-inflammatory and pain relief effects is expressed in the synovia of patients with both forms of arthritis. Okay, so they're not putting any cannabinoids from cannabis in. They just want to see if our body is going to prepare itself to receive cannabinoids if we had to take them in, if we had these conditions, specifically for anti-inflammatory, the signaling systems, or the endocannabinoid signaling systems for inflammation and pain, of course. Now, the study compared the levels of endocannabinoids. So endocannabinoids are cannabinoids that the body produces, because we do have an endocannabinoid system and we do produce endocannabinoids. Endo is meaning from within the body. Cannabinoids obviously comes from the plant, from the cannabis plant. So the study compared the levels of endocannabinoids in the synovial fluid of course, osteoarthritis patients and rheumatoid arthritis patients, compared with non-inflamed healthy volunteers. So they found that the CB1 and CB2 and RNA were present in the synovia of both osteoarthritis and rheumatoid arthritis patients. Two of the endocannabinoids that that were found were anandamide. So these are, again, endocannabinoids is what the body produces. So anandamide, or AEA. The second one is hard for me to pronounce, but I'll give it a shot. Number 2, arachidonyl glycerol, 2-AG, we'll just call it that, were identified in the synovial fluid of the osteoarthritis and rheumatoid arthritis patients, but none were detected in the fluid of the healthy volunteers. And if you know anything about the endocannabinoid system, you know that it is a system that helps us maintain homeostasis, which is basically helping us maintain balance within our internal workings. It's the system that enables us to do that. And it works like the way our traffic lights work, by letting certain enzymes or certain cannabinoids go through and others not. I think it also works with your neurotransmitters in your brain. I'm yet to go into some brain questions and read some brain studies, so I'll be able to give answers about that in the future when I start looking at the conditions like depression and anxiety and the effects that cannabinoids like CBD and other cannabinoids have. However, it does work like a traffic light system, and I personally believe that neurotransmitter it either allows certain neurotransmitters to go through or it doesn't. Same thing with enzymes, and same things with the cannabinoids or the endocannabinoids that your body produces. Now, the study concluded, right, that the endocannabinoid receptor system present in the synovium may be an essential therapeutic target for pain and inflammation associated with osteoarthritis and rheumatoid arthritis, and in my personal belief, quite possibly with bursitis as well, because they're finding endocannabinoids in the synovial fluid. All right, so if you've got bursitis, your synovial bursa is inflamed, there is a strong potentiality, especially looking at this study, particularly that your endocannabinoid system, signaling system might be on, we'll call it that, might be on, ready to receive endocannabinoids that your body produces to help reduce that inflammation, or cannabinoids from the cannabis plant, like CBD, for example, that can also plug into your endocannabinoid system to help reduce that inflammation, which is why we're seeing the results that CBD by itself is good for anti-inflammatory effects. It's effective, should I say, for anti-inflammatory effects. Whereas, if you had pain as well, that's when the combination of CBD and THC come into play. How that works is not clear in my mind yet, but as I do more work and answer more questions, that'll become more clear, and I'll be able to provide that answer for you in later episodes of the Hemp Nerd podcast. But if you want to read about this stuff, all this content that I'm basically sharing with you on this podcast is available on the website HempNerd.co. All the reference links to all the different studies that I'm referencing in this podcast, as well as on the blog, are available on the blog itself. You can click through, and you want to go nerd out on the content and dive deep into everything that I'm finding out. It's really dense stuff to read, even for me, but I'm doing my best to actually bring up what's necessary to answer your questions and to help you make a more informed decision. And the primary goal here is to help you get reliable therapeutic results, especially if you're already aligned with a pro-cannabis doctor who just, who's willing to work with you depending on what condition you're dealing with. So my final thoughts on this is that cannabis is a viable and effective form of treatment for inflammation and pain caused by bursitis. The indirect studies made publicly available on PubMed and other websites produce enough data to conclude that cannabis provides positive therapeutic effects for someone with bursitis. If you're in the market for cannabis-based products, then the next paragraph, I'm basically reading from my blog post, but the next paragraph will provide you with guidance based on my research so far. So for anti-inflammatory effects, I personally believe your best option is either a full spectrum CBD product or a broad spectrum CBD product, because CBD alone is shown to reduce inflammation. For pain relief effects, your best option is a full spectrum CBD product with a 1-to-1 ratio of CBD and THC, because CBD combined with THC is shown to provide pain relief effects, specifically in a 1-to-1 ratio. Now, if you want both pain relief and anti-inflammatory effects in one hit, then my personal belief is your best option is a full spectrum CBD product with a 1-to-1 ratio of CBD and THC, because of the reasons already mentioned. Now, your challenge at the moment with acquiring a full spectrum CBD product with a 1-to-1 ratio of CBD and THC is the current regulations, where the maximum legal limit of THC is 0.3% in a cannabis-based product. Your next best option is to find a full spectrum CBD product with as close to a 1-to-1 ratio as possible. I guess regarding bursitis more specifically, I personally believe a smart approach would be to target the inflammation first. So reducing the inflammation in bursitis, I believe, will lead to a domino effect of the pain and stiffness symptoms and everything else falling away, because the main issue here with bursitis is inflammation. So I would either go for, if you go for full spectrum, it really wouldn't matter in regards to whether it's a 1-to-1 ratio or not. Or you could also go for a broad spectrum product where there's no THC at all in the mix. because CBD alone has been shown to eliminate or alleviate, should I say, inflammation in your body. Hopefully, this episode has been insightful, has provided some clarity as to whether CBD would work for bursitis. If there's anything that I've missed, any study that I've missed that you think I should look at that either continues to support the case or opposes the view that we have at the moment, feel free to let me know. Jump on the blog, leave a comment to let me know. If you're viewing this on YouTube, leave a comment to let me know. Otherwise, I appreciate your time and your attention. Again, all the links, all the references are available on HempNerd.co. Feel free to pay us a visit there. Read what I write. Hopefully it makes sense. Hopefully it provides clarity. And the main purpose here is hopefully that it enables you to get more reliable therapeutic results as opposed to doing guesswork when you're out there in the market trying to figure out which oil is going to work, because everyone's a bit different. And yes, I mean, cannabis is coming through as the miracle medicine, so to speak, the miracle drug, the miracle medicine. But I think, or I personally believe that we're going to it's work best for us if we actually understand how it works, and if we take the time to actually look at the data and see where it's most effective and even what strands are most effective for what conditions, as opposed to it's a taking the approach of a one size fits all solution. Anyway, that is me for today. Take care, God bless, and I will catch you on the next episode of the Hemp Nerd podcast. Peace.